Hello, today I wanted to talk a little bit about cruciate disease in dogs and occasionally in cats, but mostly in dogs. And so I'll base this discussion a little bit more around our canine patients versus feline because it's much more common in our canine patients. But what is a cruciate ligament? And so the cruciate ligament sits within the knee and helps stabilize it. Everyone has heard of an ACL tear in people, and that is the same in our dogs, although we call it the CCL or cranial cruciate ligament versus the anterior cruciate ligament in people. And the only difference in the name is because our dogs stand on all four legs instead of standing upright like we do as people. And so it's a directional difference, but the ligament itself has the same job, and that's to help stabilize the knee joint. And so what the two main actions are for the cruciate ligament are to reduce drawer or movement of the tibia in relation to the femur. So they should not be able to translate back and forth in relationship to each other, and also to minimize interior or medial rotation of the tibia in relation to the femur. And so if here is the base of your femur and here is your tibial plateau, your tibia should not be able to rotate in this direction. And so that action is actually why dogs that have a medial patellar luxation are predisposed to cruciate tears, because over time that little internal rotation will put excess unneeded pressure on the cruciate ligament. And so now that we have a little bit more information about the cruciate ligament, why does it tear? So it can tear because of trauma, and so that's why most humans have an ACL tear, is because of some trauma, whether it's sports or a car accident, that will put too much pressure and the ligament itself will rupture. In our dogs, most of the time, cruciate ligament ruptures occur because of chronic degeneration. And so over time, that cruciate just gets weaker and weaker and weaker and weaker. And then one day your dog is doing something that's done its entire life and the ligament just can't hold up anymore. And so it ruptures. And then you start seeing signs of cruciate ligament disease in your dog. And so, it's not usual that someone comes in and says, oh, my dog fell and now they're limping like this, and then we diagnose them with a cruciate tear. Usually it's something like, oh, well, they kind of had a little limp a couple months ago, but then it seemed to get a little bit better, but now they've been limping for a couple of weeks and it's just this limp that is not going away. And that is very, very common with cruciate ligament disease. And so how do we diagnose cruciate ligament disease in the clinic? And so one way is they have a very, very commonly diagnosed way of walking. And so we call it a toe touching lameness, where, they'll put a little bit of weight on those toes on the back leg, and then they're like, oh, no, that hurts. And so it's not completely non-weight bearing. Usually if a dog has a fracture or dislocation, they don't want to put any weight on the leg at all. And so whenever you have a cranial cruciate tear, they'll put just a little bit of weight and then they let up, and a little bit of weight and then they let up. And so they will walk on it just a titch, and then they feel pain, and so they bring the weight off. Another way that we can diagnose it is by palpation. And it is best to do palpations on sedated patients, because sometimes if they're very painful or very anxious, they can tighten those muscles enough that you won't actually get the laxity that you're looking for. And so what you do are called cranial drawer method, where you actually take hold of the femur and the tibia, and if you can shift those bones against each other, remember we said that was one of the main jobs of the cruciate, to prevent that motion, then the cruciate is torn. Another way is called tibial thrust, and so it's the same motion that you're looking for, just a slight different hand position. The gold standard for diagnosis of cruciate disease, especially if you have a partial tear where maybe you don't have that full translation quite yet, is radiographs. And so we take radiographs and look for evidence of joint effusion in the stifle. And there are a few different things that we look for. blunting of the infrapatellar fat pad, and caudal displacement of the fascial plane of the gastrocnemius muscle. And radiographic drawer is also really nice to have. And if you have those things, then that patient does have a cruciate tear, whether it be partial or full. And so now we know we have a cruciate tear. What do we do? How do we address this? So it is a surgical issue. I've only ever heard of dogs weighing less than 5 pounds actually recovering with strict kennel rest for 8 weeks. Usually if it's anything above 5 pounds, they're going to require some type of procedure. There are many types of procedures out there that you can do to repair a cruciate ligament. I'm going to focus on the 2 that we do in our hospital so that this isn't a 3-hour long video. And so the commonly used one for smaller to medium-sized dogs is called a lateral suture procedure, or an extracapsular stabilization. And what that is where you have the stifle. So this is just a tibia, and we'll talk about this bone when we talk about our other surgery, but I'll use it for an example. So this is our tibia, and then the femur sits on top, and you use heavy duty surgical wire or string, and you actually recreate the action of the cruciate ligament by going from these tiny little bones behind the femur through a hole in the front of your tibia, and that has the same angle and direction of the cruciate ligament itself. But you're not doing anything as far as like cutting the bone. It's a pretty low invasive procedure. I do recommend that procedure in smaller breed dogs, older dogs, dogs that are a little bit less active, or there's just going to be less pressure on that suture over time. And they do really well. I will say when I was in vet school, they said, oh, don't ever do extracapsular repairs. They're trash. I've done them a lot, and even on some dogs that were larger than I necessarily would have liked, but it came down to a cost situation with the owner, and they've done really well. And so I do like that procedure, but I think it has a place. So that brings me to our second procedural option, which is a CBLO. This is a very new procedure in the grand scheme of knee repairs in dogs. It's only been around for about 10 years, and now it's kind of starting to trickle from the teaching hospitals out into private practices. And so what does that stand for? A CBLO stands for Cora-based leveling osteotomy. And what does that look like? Because that's a lot of crazy words. And so basically most dogs that have a cruciate tear or are predisposed to a cruciate tear have an inappropriately steep tibial plateau. And so their tibia, instead of being nice and flat where the femur can sit right down on the middle of it, it's angled. And so the femur naturally wants to slide off, and that over time puts pressure on that cruciate ligament and helps degrade it. And that sliding also causes pain. And so what we do with a CBLO is we flatten that plateau out, much like with a TPLO. But we're not going to discuss a whole lot about a TPLO today because we don't actually perform those in our practice. We do the CBLO procedure. And so this is an example of a bone that has had a CBLO plate put on it. This is a fake bone. Don't worry, I didn't harvest this. So what we did was we took a lot of measurements off of our radiographs and decided how much rotation we needed. And so when we started, this tibial plateau was angled back like this. And so we made a rotational rounded cut through the bone and then rotated that piece forward. And so by rotating that piece forward, you then form a nice flat surface for the femur to sit on. And in order to properly secure this, we have a compression screw coming from the cranial to the caudal part of the bone, as well as a second K-wire. And then we have a special CBLO specific bone plate that's been applied, all to help stabilize that. These heal incredibly fast. The studies have shown up to 80% of these are healed at 6 weeks post-op instead of 8 to 10 weeks like many other orthopedic procedures. And that's because you can put compression on your osteotomy site or your cut in your bone. And so these patients, I've done quite a few of these now, and they've done very, very well. They seem quite comfortable. I mean, even as they're walking out of the hospital. I've had the most common comment I get from owners after this procedure is, did you even do anything? I mean, I see that there's an incision and I see that my pet's leg is shaved, but they're acting like they haven't even had surgery, which is, of course, what we all want to hear. So what are the most common complications with either of these procedures? So anytime you're leaving an implant in the leg, whether it be the lateral suture or a bone plate, infection is going to be your most common complication risk. And so what we do to try to prevent that is we do give preoperative and intraoperative antibiotics, as well as use a special coating to put on the limb called Ioban. And so that helps kind of cover the whole leg and make sure you're cutting into a sterile environment. Those are some, things that a lot of hospitals do to minimize risk of infection. It still can happen. If it does, it's not usually the end of the world. You just have to take your implant out after the bone is healed. But again, that's pretty low. I would say that happens 5% or less of the time. And so, that's the most common complication, but still very, very low risk. You can have implant failure with both the lateral suture or the CBLO, where the screws back out or the plate breaks or something has broken or your lateral suture breaks. And so in those cases, you do have to go in and repair your surgical site. However, again, very, very rare that happens. Usually it's because somehow the pet broke out of their kennel and is running around like a nut job when they're not supposed to be. I will say activity restrictions for lateral suture, they are actually harder on activity restriction than on the CBLO. So my lateral suture patients, I require them to be strictly kennel rested for approximately 8 weeks post-op with just minimal walking on a leash. CBLO patients, I like them to be up and walking and moving around the week after surgery on a leash and in a controlled manner, of course, but I actually like to get them back to activity quicker than my lateral suture patients. And so that's another big difference, and it helps owners because they feel bad about leaving their pet in a kennel for 8 weeks. And so if we can, get them moving a little bit faster, then absolutely. So why would I choose a CBLO over a lateral suture? CBLOs are more appropriate for larger breed dogs. And so I mean larger breed, anything 40 pounds and above would really benefit from having a CBLO procedure done. Also, young active dogs who are more likely to tear their suture, they would benefit from having a CBLO. They're going to do better long term. Other reasons you would do a CBLO are juvenile dogs. And so dogs that have a growth plate that runs right along here. So whenever TPLOs were and they're still most commonly done, but if you go to a practice that does TPLOs and your pet is not yet fully mature and that growth plate is open, you should not do surgery until after the growth plate is closed because you're going to damage it. However, with a CBLO, our cut is low enough and our plate sits low enough that you can actually do this procedure on juvenile dogs that are not fully mature and not interfere with their growth plate and not damage that. And so I've actually done a couple dogs so far that have been 6 to 8 months old, and they've done quite well. Because their growth plate is still open. But again, by having a lower cut than a TPLO and a lower sitting plate, you're not going to interfere with that growth plate like you would with the other procedure. Lateral sutures, again, not ideal for young dogs, but sometimes it does come down to a cost. CBLO is quite a bit more expensive than the lateral suture procedure, and prices are going to vary as far as, your geographical location. We're in a small town in Southeast Missouri, and so I'm sure our prices are quite a bit different than if you even went to St. Louis or a bigger city somewhere else. But the procedure itself will be the same. So recovery, we talked a little bit about activity restriction. Like I said, they both do really, really well as long as post-op instructions are followed. That's the biggest thing that I tell clients when we're talking about these surgeries before they're done is don't spend all this money on a surgery and then not follow any post-op instructions, because that is so frustrating for me. It's frustrating for the client after there's a complication and then they feel guilty and bad. Like, let's just work as a team. I'll do my part, you do your part, and hopefully the dog will do their part and behave. But yeah, they're both really good procedures for cruciate disease in dogs. I usually send them home with, a few weeks of pain medication, regardless of which procedure they have done, and they do really well. So hopefully that helps with a little bit more information about cruciate disease in dogs. One other little fun tidbit is, once a dog has torn one cruciate, they will likely tear their other one within a year, are the statistics. 50% of them will tear their other one within a year. And so that's another reason I don't like to wait very long to get this repair done, because now we're just a ticking time bomb for the other side to tear, and then we'll have to do surgery on that one as well. So I'd rather fix one and then fix the other one a year later, rather than have two of them back to back that need to be repaired. So if you have any questions about cruciate disease or the different surgical options available, please drop them below.